Sorry, we are 5 minutes late because the dean had called me. Otherwise, we should start sharp at 10 because you've got a class after this also. I believe you've been taught poliomyelitis, isn't it? By Dr. Mayuri. Hello?
Yes,
Yes,
sir.
sir.
Yeah, so intestinal infections, if you see the book, it starts with polio. Polio has been covered. So we go to the next major one, which is viral hepatitis. Okay? A term which all of us must have used so many times in our lives, and some of us may have had the disease also in our childhood or perhaps in our teenage. Viral hepatitis is an infection of the liver caused by any of half dozen viruses, right? We are only talking about viruses nowadays, including the lethal COVID. 20 years ago, hepatitis A virus and hepatitis B were the only known etiological agents of viral hepatitis. When I was a student like you, we were just hearing about the others. It was not there in the book. Our teachers told us, remember, in case you're asked in the Viva, that there is something called a CDE also. But now it is documented that in addition to HIV and HBV, we have got C, D, E, and G, and perhaps an F also. They are recognized as etiological agents of the disease. It is known that many other viruses may be implicated in hepatitis, such as CMV, EBV or Epstein-Barr, yellow fever, and rubella. Viruses of herpes simplex, varicella, and adenoviruses can also cause severe hepatitis in immune compromised. But all this is rare. Today we are talking about the hepatitis A, B, C, D, E, and G viruses. Well, this is a photograph taken from the net. If you see, it gives you the particulars of the type of virus that we are dealing with. Hepatitis A is an RNA virus, picornavirus, non-enveloped, spread by fecal-oral route, and it's an acute infection. Connected with hepatitis A is hepatitis E. Please remember, A and E are connected, and all the epidemics or outbreaks, or perhaps what me and you have had, is because of hepatitis E. Hepatitis E is again RNA virus, herpes virus, non-enveloped, fecal-oral route of transmission, and acute. If you see the middle three, B, C, and D, they are all acute and chronic infections. All of them cause hepatocellular carcinoma. Perhaps C, it is rare, but hepatitis B and D, they lead, if not controlled, to hepatocellular carcinoma and cirrhosis. And you will see that except for hepatitis B, all of them are RNA viruses. Please remember, this is just a comparative chart. We will go one by one. Vaccines offer protection from hepatitis A and B. No vaccines are available for hepatitis C, D, and E. Please remember, even if you have taken a vaccine in your childhood, you may still get jaundice because you are now affected by E. We all know B, C, and D are transmitted exactly the way AIDS virus is transmitted. Reducing exposure to the virus offers the best protection. So the best prevention is, even against COVID, reducing exposure. That's why we are locked down. That's why we are quarantined, because we are reducing exposure. We are not meeting each other. We are not shaking hands. We are not going out. We are not buying things. Malls, halls, everything is closed. Hepatitis A and E usually resolve on their own. If you remember in your childhood, some of you, including me, who had jaundice, we were sick for some time. Our mother gave us all boiled food. The doctor gave us some medicines like Live 52. And after a few days, we became okay and we started going to school again. Hepatitis B, C, and D can be chronic and can be serious. Drugs are available to treat chronic hepatitis. These are some common points I made out. The lesson is big. I have tried to reduce it into a few slides and tried to make it as simple as possible. An acute or subacute febrile infectious disease characterized by sudden onset, nausea, anorexia, and abdominal discomfort. Remember your days of confinement because of jaundice, followed by dark colored urine, light colored stools, and appearance of jaundice in sclera, that is yellowing of the sclera, or skin. and caused by various viruses starting from A to G and even F, some people say, is the definition of hepatitis, viral hepatitis. Please remember, whenever you are asked to write a question about a disease, if you see the book, textbook also, the first para, just after the title, gives the brief definition, the signs and symptoms, and a few preventive measures in a small para in the beginning. You are supposed to begin your answers like that. So, though these are clinically similar diseases, they differ etiologically and epidemiologically. So, we will see to that. We will go one by one, as I told you. Hepatitis A, formerly it was called as infectious hepatitis and epidemic jaundice. Okay, heralded by non-specific symptoms like fever, headache, chills, fatigue, generalized weakness, aches and pains. So nothing great. It can be this, it can be cold, it can be any other viral infection. It is followed generally by anorexia, nausea, vomiting, dark urine, jaundice, and sometimes it becomes a little incapacitating. You can't go to school, you lie on the bed, you look lethargic and anorexic, and you don't eat and you become weak. Of course, hepatitis A is a benign disease and we have complete recovery in few weeks. Case fatality, as you see, is negligible. But people who have died of hepatitis A, they have died because of acute liver failure. This is the worldwide prevalence. You will see it's highly prevalent in our country, though there are 3 zones marked as high, intermediate, and low. In your book, it is given as high, intermediate, and low. You can make out all this is high, including the huge island of Greenland. Okay? But North America, Europe, the Western Europe, Australia, they are all low. In between Russia, China, all these are intermediate or moderate prevalence. Even when you are asked a question on a certain disease, you have to, in SPM, write something about the problem statement. You can give it in the form of a map, which you can draw, or you can just write a few lines. But remember, you must always write before you come on to the basic epidemiology, which is agent, the host, and the environment. Right? We will start with the agent of hepatitis A. It's an enterovirus, type 72 of the Picornaviridae family. Fecal shedding is there in early acute phase and later part of the incubation period. Okay? Resistance, it is resistant to heat and chemicals, survives in well water for 10 weeks. Remember, when the villagers draw the water from the well and drink it without chlorinating it or without perhaps sterilizing it or disinfecting it, they obviously fall prey to jaundice. It is not affected by Cl, that is chlorine, in doses employed for routine water treatment. Remember, the Manjira water or the other treated water which comes to your house from the Hyderabad waterworks or any other city that you are in can be treated, but still you may get jaundice. Okay? It is actually not affected by formalin, boiling, autoclaving, and it is not affected by chlorine, but formalin, boiling, autoclaving, and UV rays inactivate the virus. That's why we have UV filters in our houses or reverse osmosis filters, which also have UV. The reservoir, man is the only reservoir. The peculiar thing is there can be anictoric cases amongst children, and there is no chronic carrier, as I told you. Period of infectivity, 2 weeks before to 1 week after the onset of icterus. So before I get the jaundice, the symptoms, I can infect you. Infective material, I told you it's fecal-oral. So whatever we use, mainly after feces, if we don't wash our hands after cleaning, we can touch our things, and those fomites can also cause the disease to spread. Blood, serum, and other fluids have been incriminated, but generally it is spread by the fecal-oral route. Excretion in feces 2 weeks before onset and 2 weeks thereafter, right? So we talked about infectivity, and we talked about excretion in the feces. It is also excreted in the urine. Post, in children, it is seen more in adults. It is seen more in incidence than in adults. The severity increases with the age. In case you get jaundice as an adult, that is considered to be more serious. Fecal excretion has been seen to last longer in children. Both sexes are equally susceptible. Immunity after attack, it lasts for life, but there are second attacks in few. In about 5%, we can have a reinfection. Environment, it happens all through the year. That is because India is known for rains nowadays all through the year, poor sanitation, overcrowding, ignorance, lack of hand washing, practices which we are now perhaps practicing because of the COVID. The modes of transmission are fecal-oral and parental, but the parental route is very rare. Sexual, mainly in homosexuals because of oro-anal contact. Okay, incubation period varies between 10 to 50 days, so it can be about a week, it can be 2 weeks, it can vary up to say about 1.5 months, right? But generally it is 2 to 4 weeks is the incubation period. The clinical spectrum, I did not tell you, you people have gone to clinics, you have seen cases of jaundice, the GI symptoms or the gastrointestinal symptoms with mild fever, icterus, but there can be anicteric hepatitis, which is more common in children, right? Inapparent or subclinical infection in children, and the icteric disease is seen mostly in adults. So children may have the infection, but not present with yellowing of the sclera or whitish stools or yellowing of the skin, okay, or dark colored urine. So they may not present with that, but generally they do. But many adults or most of the adults will present with that. The complete recovery is there in 98 to 100% cases. There is no chronic state, and as I told you, mortality is negligible. The diagnosis, we all know, is by liver function tests. All of us have taken these tests in our lifetime. Basically, we see the bilirubin or certain enzymes. For specific diagnosis, we look for the viral particles in feces, bile, and blood. That's a humongous process. What we generally do is LFT. The prevention and containment of hepatitis A, remember, is very important, and it is to be practiced by you and me. The disease has to be notified to the correct authorities. Complete bed rest is given, and disinfection of feces and fomites with 0.5% sodium hypochlorite is important. If there is feces, it cannot be disposed of like that. If there is a fomite, it needs to be disinfected. We have talked about disinfection and sterilization in the chapter Concepts of Health or on maybe in epidemiology. Control of transmission is by personal and community hygiene. Don't shake hands, wash your hands, sanitary disposal of excreta, water treatment. I talked to you about chlorination. I talked to you about RO filters in the house, boiling the water. Then the distribution of the water has to be improved. Control of susceptibles. High-risk groups are the travelers. I travel from a non-endemic country to India, and India is endemic. So I am a traveler and I am exposed to the risk. They require lifelong treatment. Those who require lifelong treatment with blood products, men having sex with men, that is MSM, workers in contact with non-human primates, okay, non-human primates, that is animals, okay, then chronic liver disease patients and people having IDUs. Continuing with the prevention and containment, the most important part is the vaccine. In formaldehyde inactivated vaccine is available, which is given intramuscular, 2 doses, 6 to 12 months apart, extended to about 18 to 36 months. Okay, in case you cannot get the second dose, you can take it later also. Many of you may have taken this vaccine. We have talked about this vaccine in our clinical postings. If you open your practical records, you can see that you've written something about the hepatitis A vaccine. It is not meant for infants, that is below 1 year of age. It is often combined with other vaccines like hepatitis B, and it is quite efficient. We also have a live attenuated vaccine. Since it is live, more potent, we give only 1 dose as compared to the inactivated where there are 2 doses. The live vaccine is given subcutaneous, not intramuscular. It is manufactured in China and it is available in various countries. It can also be combined with others, and it is generally considered as a pre-exposure prophylaxis for travelers and post-exposure prophylaxis for contacts. Human immunoglobulin has limited role, but it can improve passive immunity of travelers, right? Just remember, there is immunoglobulin against hepatitis A also. Sorry. We come to the most important part of this lesson, that is hepatitis B. So hepatitis A, we know how it is transmitted, who's the host, and what are the signs and symptoms, and simply how do we protect ourselves by following certain hygienic measures, by bed rest, and by the most important method of vaccination. We come to hepatitis B, it is called as serum hepatitis also, right? Acute systemic infection with pathology in the liver, transmitted parenterally. It is not transmitted fecal-orally, it is transmitted through blood. Long incubation period, there is protracted illness with varied outcomes. It is a self-limiting disease, but it can lead to chronic or subclinical states. In acute disease, it is self-limiting, and there can be hepatocellular necrosis. The case fatality rate again is minimal, like in viral hepatitis A. But once it becomes chronic, it is a persistent carrier state and may progress to, just imagine, underline the most important consequences and fatal consequences, which is chronic active hepatitis, hepatocellular carcinoma associated with causation of primary liver carcinoma. So remember, hepatitis B is dangerous, is a serious disease, can lead to a chronic state of chronic active hepatitis, further leading to carcinoma. With Delta virus or hepatitis D virus, it is now causing a new form of virulent hepatitis. Like tuberculosis we talked about the other day is often associated with HIV. Similarly, hepatitis B is often found together with HDV. This is the geographic distribution. If you see, India has been spared and now it has come in the intermediate group. But Africa, Canada, and Alaska, and the parts of China and other Southeast Asian countries, including the north countries of South American continent, they are highly infected by hepatitis B. America, Australia, and Greenland, however, comes in the low prevalence state. Hepatitis B, the agent is a complex 42 nanometer double-shelled DNA virus. All the other hepatitis viruses are RNA, but this one is DNA. It occurs in 3 morphological forms in serum of patient. The bulk is a smaller antigenic spherical particles, tubules of various lengths and diameter, and the all-important Dane particle. So there are 3 parts of the virus. Therefore, some of the bulk is spherical particles. There are some tubules, and there is the all-important Dane particle. The reservoir is again man. Infective material, as I told you, it is parenteral transmission. So it is blood, and sometimes also in saliva, vaginal secretions, and semen. Okay, resistance. This is a stable virus. Even hepatitis A we found to be very stable. It survived for days, readily destroyed by sodium hypochlorite or heat or autoclaving. So we got to boil our water, we got to disinfect the feces, we got to disinfect the fomites. This is the most important take-home lesson to avoid hepatitis. Period of communicability, present in blood during incubation period, and acute phase. Communicable for a few months to years. I talked about a chronic carrier case in the previous slide. Okay, we talked about chronic persistent carrier state, right? In the chronic infection. So in case somebody is a chronic carrier, he can communicate the disease to many for few months to years, or until disappearance of the HBsAg antigen and appearance of surface antibody. We will talk about the antigen and the antibody in a while. Host, age, outcomes are age dependent. Okay, it happens to you at a senior age or in an adult age, it is more serious. Acute illness can happen in perinatal people, that is the young children, 1%, early childhood about 10%, more than 5 years of age, 30%, and mortality is about 70% in case it happens as an acute hepatitis B infection. Chronic illness, inversely related to age, right? Perinatally, 80 to 90%, okay? And early childhood, about 30%. As the age increases, chronic illness reduces, okay? So therefore, one can become a carrier right from the childhood. High-risk people are those who are recipients of blood transfusions, healthcare personnel like me and you. That's why we took the hepatitis B vaccine. Homosexuals, commercial sex workers, IV drug users. I talked about the IDUs, that is IV drug users, infants of HBV carrier mothers, and of course, the all-important immunocompromised people. These are the high-risk patients who may get hepatitis B sooner than me and you. HIV infection, it markedly increases the risk of hepatitis B. Just imagine what a big culprit HIV is. It increases your risk of having tuberculosis. It increases your risk of having HBV associated cirrhosis or carcinoma. Okay, there are humoral and cellular responses. 3 distinct antigens of hepatitis B have been noted, and we have to remember all 3, especially the surface antigen or Australia antigen, that is HBS, S small, A capital, and small g. There is a core antigen, HBC antigen, and there is an E antigen, which is HBE antigen. So S, C, and E. Remember this. There are 3 distinct antigens which stimulate production of antibodies. And no marks for guessing. The antibodies are called anti-HBS, anti-HBC, and anti-HBE. Simple. For those who are a little confused because they have learned it in perhaps pathology also and cannot recollect, please remember S, C, E. Form your own mnemonic. S is the most important one. And similarly, in antibodies, anti-S, anti-C, and anti-E. These are the important markers for HBV infection. This is a diagram which you will see very often. This is there in your book. It shows you how initially anti or HBsAg rises and then it falls to give rise to anti-HBs. So initial part of the infection, in case you test for HBsAg, he may be found to be HBsAg positive, right? And later on, he gets the antibodies. Similarly, all the other antigens, like this is the HBe antigen, and once it finishes here, once it peaks and finishes, the HBe, anti-HBe comes. Similarly, the anti-HBc initially rises and then plateaus off, right? So, and the time period is given out here. Even up to a period of 20 years or more than 20 years, a person can have the antibodies because he was infected much before in his childhood or teenage or whatever. Please remember this diagram. Draw it in case you get a question on hepatitis B. Modes of transmission: parental, perinatal, and sexual. I talked about men having sex with men, so sexual. Perinatal, I talked to you about mother and child. And child-to-child physical contact has been noted, but it has for other countries here. The incubation period as compared to HbA is longer, as I told you, and it is about 1 month to 6 months. Average is about 2 to 3 months, right? Please remember the other one was 1.5 months max. It was about a month, 14, half a month, 14 days to 28 days. This one, the incubation period is about 1 month to 6 months. You have to remember this, mug this up, and also reproduce it in the exam. Clinical picture, similar. So it's very difficult to find out about hepatitis A and B unless there are complications. But you got to send the patient for HBsAg in the lab, HBsAg, and you got to also test the stool for the LFT, also get the LFT done. So diagnosis is by rapid diagnostic tests and certain immunoassays, which are given in the book, but basically we go for rapid diagnostic tests. There are 5 C's the WHO has formulated for HIV and hepatitis testing. This also holds true for HIV testing. They are consent, confidentiality, counseling, correct test results, and linkage or connection to prevention, care, and treatment. Nothing new, just 5 C's. May be asked in the exam or in the viva, right? Consent. You got to take a consent before you take a SAG test or a HIV testing. You must maintain confidentiality. I can't tell other people so and so has got HIV or so and so has got HBV, right? Pre and post test counseling, we will talk about it in HIV/AIDS in details when we teach you that, but that is most important. You got to counsel the patient. Correct test results are very important. The lab must be proficient enough. The lab people must be trained enough to give you the correct results. In case the results are incorrect, let me tell you, I can't explain much because the time is limited. The results can be devastating. People have taken their lives because the labs have given them incorrect results stating that they are HIV positive. The connection and linkage to prevention, care, and treatment. Obviously, after you get your test results, you have not to, cry and get angry and feel frustrated or depressed. You have to take the other precautionary measures or go for treatment. Hepatitis B containment. All the other methods of hepatitis A containment need to be followed till the time you are sure that it is hepatitis B. When it is hepatitis B, the only preventive measure we have is the vaccine. Once you are hepatitis B positive, the vaccine has got no role. So then you got to be careful about the other things that we have talked about, how not to get it parenterally. There is a recombinant HBV vaccine and there is a plasma-derived vaccine, right? That is inactivated. What we generally use nowadays is recombinant vaccine. Since the late 80s, me and you have taken a recombinant hepatitis B vaccine. It is cost-effective, safer, cultured of yeast cloned with HBsAg gene, okay? We don't have to remember that much. Remember, it is given IM. The hepatitis A vaccine was given SC or subcutaneous. This is given in the deltoid or in children less than 2 years in the anterolateral aspect of the thigh, right? And this is given as a dose 013. Some people follow 016. You can take the 0 dose now, the second dose after 1 month, and the third dose after 6 months. Some vaccine manufacturing companies say 0, 1, and 3. That is after 1 month. 0, 1, and 2 you can call it also. That with 1 month gap, you take all the 3 doses. What is important is given IM and it is given within 3 months with a month's interval between the vaccine, and you require a booster every 5 years. Actually, it gives you a protection, but then you require boosters every 5 years. Storage is at 2 to 8 degrees centigrade like we store other vaccines, and it is efficient, gives you about 95% protection. It can be a monovalent vaccine, or we are talking about pentavalent now in the national schedule. Hepatitis B vaccine is also a part of the other 4 vaccines which make it pentavalent. Pentavalent vaccine, what consists of pentavalent? Please remember that DPT, hepatitis B, and Hib. You must remember this exam question. So hepatitis B vaccine can be monovalent, can be a single vaccine, which me and you have taken because when you were young, there was no pentavalent. And it is also given as a pentavalent vaccine nowadays in the national schedule. It is contraindicated in very few, only in those with allergy and in the pregnant and lactating woman. Recommendations for hepatitis B vaccine, all infants, adolescents less than 18 years of age, like you must have taken it when you entered Bhaskar Medical College, or perhaps before when you were in intermediate, or as they call it, class 11 and 12. People occupationally exposed to blood and body fluids, the lab technicians are supposed to take. Residents and staff of institutions for the disabled because they may often come across some disabled falling down, and they may come in contact with their blood and other body fluids. Patients receiving hemodialysis, hemophiliacs, and other patients receiving clotting factor concentrates, household contacts, and sexual partners of patients infected with hepatitis B chronically. Remember, these are the clientele who have to take hepatitis B. Of course, it's a part of the national schedule now. Travelers who spend more than 6 months in endemic areas, injection drug users or their sexual partners, what we termed as IVDUs, men who have sex with men, men or women with multiple sex partners, or recent infection with sexually transmitted infection. Inmates of long-term correctional facilities, perhaps I'm talking about a jail or a juvenile delinquency home. So these inmates are supposed to be given hepatitis B. There is hepatitis B immunoglobulin also for those acutely exposed to hepatitis B antigen and blood. It should be given as soon as possible within 6 hours, but not later than 48 hours. After exposure, it is given in a certain dose as per your body weight, and the protection lasts for about 3 months. Please remember, hepatitis immunoglobulin is passive immunization. Passive active immunization can be combined, and the other measures are that all blood donors are screened for hepatitis B. The instruments are sterilized by healthcare personnel because they may be potential carriers of hepatitis B virus. Carriers are not to share razors. Okay, when we go to those of us who have been to a barber shop, they know that when the barber is making our or styling our hair, he uses a different razor for each one of us. Okay, don't share your toothbrushes because sometimes our gums may bleed. And people who are donating blood or using barrier contraception, they are not supposed to do so in case they are having hepatitis B. Guidelines for prevention, care, and treatment of people living with chronic hepatitis B infection. WHO formulated some guidelines. Please remember that there are certain guidelines to promote the use of non-invasive diagnostic tests, prioritize treatment, recommend the preferred use of nucleosides, analogs. They are all okay. You use drugs like tenofovir and entecavir and all that. That is okay. But just remember, WHO formulates policies every other year for such diseases, and you can just mention at the end of your answer that there are guidelines by the WHO. They also recommend lifelong treatment for those with cirrhosis and those with high hepatitis B DNA and evidence of liver inflammation, and regular monitoring for those on treatment. So that is what the WHO is saying, the same thing as we have talked about. They say, please give proper treatment to those affected, monitor them, and do not deny them diagnostic tests, and also prioritize those with most advanced liver disease. Okay? So WHO guidelines. There is a global health sector strategy also by the WHO, 2016 to 2020. It highlights the critical role of universal health coverage and sets targets that align with the Sustainable Development Goals. There are global targets to reduce viral hepatitis by 90% and deaths by 65%. I am talking about viral hepatitis A, B, C, D, E, and G. I am not talking about hepatitis B per se, but it pertains most to hepatitis B because that's the most dangerous part. That's the most dangerous of all hepatitis. And also, the way it is given in your book is after hepatitis B, right? So, to raise awareness, promote partnerships, mobilize resources, formulate evidence-based policy and data for action. It also tells the health authorities to prevent transmission, scale up screening by blood tests or by rapid diagnostic tests, and also improve the care and treatment services. WHO recently published the progress report on HIV, viral hepatitis, and sexually transmitted infections 2019, outlining the progress of all three towards elimination. So remember, we have just completed hepatitis B, parenterally transmitted, more dangerous than hepatitis A and E, and the symptoms and the signs are almost the same, except for the mode of transmission. And it's a tough virus. The incubation period is longer, as well as the prevention is by vaccine, that is by intramuscular recombinant DNA vaccine, which is given to you every for 3 months with 1 month gap in between, in case you have not taken the vaccine now, and it is given at birth as well as in the 6 weeks, 10 weeks, and 14 weeks to the small children. Okay, it requires a booster every 5 years. Last 5 minutes, we'll quickly go through the other viruses. I have tried to make one slide out of each virus, so concise, because the lesson in your book gives you some paragraphs which may confuse you. From the exam point of view, read hepatitis A and hepatitis B thoroughly. Hepatitis C, D, and E, remember, if you are doing well, we may ask you in the viva, or in case the question is viral hepatitis, just make a mention because you've got limited time. Similarly, if you have read about hepatitis B, you will remember hepatitis C easily, because except for the fact that it is RNA, all the other things are almost the same. It is transmitted parenterally, it is transmitted amongst IV drug users, it is transmitted through the sexual modes among men having sex with men, and it is also transmitted from the mother to the child. The mortality luckily is less, about 0.5 to 1%, and the diagnosis is by ruling out hepatitis A and B. So a difficult diagnosis, right? There is no vaccine against hepatitis C. The only way we can prevent hepatitis C is by taking the precautionary measures. IEC stands for information, education, and communication. Till a few days back, or few years back, interferon was given as a drug of choice, but now direct antiviral agents called as DAA are given. These are very expensive treatments. Only few can afford it, right? Hepatitis D. Again, if you have read about hepatitis B and C, D becomes easier. Parenterally transmitted hepatitis found all over the world. Hepatitis D virus cannot survive on its own, and therefore it piggybacks on the hepatitis B virus. It is also called as delta agent, defective virus, and also sometimes called as Dane particle, like we talked about hepatitis B. One of the parts of the virus is called as Dane particle, right? So remember, hepatitis D and B, they coexist. Hepatitis C, almost similar to hepatitis B. And hepatitis D, needless to say, is transmitted by contaminated blood, in intravenous drug users, and again from sexual modes from men to other men, and also perinatally. So if you have read about hepatitis B, C and D becomes easier. Except remember, hepatitis B is a DNA virus, these two are RNA. Hepatitis B has got a vaccine, C, D don't have a vaccine. Hepatitis D incubation period is slightly shorter, right? There are two types, Mediterranean type and the United States and North Europe type. You don't have to worry so much about the types. Patients with chronic hepatitis due to hepatitis B and D develop cirrhosis rapidly. Hepatitis B develops cirrhosis. But in case hepatitis D agrees to shake hands with it, the cirrhosis develops more rapidly. Okay? So there is no vaccine against hepatitis D. What we can offer the patient is hepatitis B vaccine. Almost to the end, we come to hepatitis E. If you see in the brackets, I've written a year also. It was discovered in the year 1980. This causes waterborne hepatitis epidemics. At the beginning of the class today, I told you, epidemics are not caused by hepatitis A, though it was nicknamed as infectious hepatitis or epidemic hepatitis. Hepatitis epidemics, as the last one which happened in Delhi in 95, 96, is because of hepatitis E. In case many of us in the class fall ill because of hepatitis, it will be hepatitis E. Again, RNA virus, If you have read about hepatitis A or if you've understood hepatitis A, you just have to remember the only difference is perhaps in the incubation period, which is a little longer. That was about 2 to 4 weeks. This can go up to 8 weeks, right? It's a clinical self-limiting acute viral hepatitis, and it appears, or it can be an acute fulminating illness, but then the mortality is rather low. There is no chronicity. Anti-HVE antibodies can be detected, but it's cumbersome. The treatment is basically non-specific, supportive. There is no vaccine against hepatitis E. What we have is hepatitis A. Please remember, when travelers travel to a country like ours, which is endemic, tell them to take all the precautionary measures, starting from the simple hand washing to the others that we just talked about, the fomites, the fecal-oral route of transmission. That's why ODF, open defecation free. One of the diseases which is spread because of open defecation is hepatitis. Hepatitis G is a flavivirus. Its prevalence is not known. It's associated with blood transfusion. So we have come to the end of the chapter on hepatitis. A and B we have described in detail. C, D, E, and G, just a few points. If you have understood hepatitis B, C, D become easy, and perhaps even G. Okay? But if you've understood hepatitis A, then E becomes easier. Just remember the incubation period. You can form a small table, write what type of virus, incubation periods, and of course, by now all of you know, or all of you must have also taken hepatitis A and B vaccine. There is no vaccine for the other hepatitis. This is again the same thing. Global Health Sector Strategy on Viral Hepatitis. I just talked about it. Okay, it is actually 2016 to 2020. It is not 21. Adopted in May 16, and it has got some prevention and treatment interventions as far as the WHO is concerned. Right? We all know what is prevention. 3 doses of hepatitis B vaccine, prevention of mother to child, blood and injection safety. We all know how to do that. It's a separate chapter by itself. And harm reduction for drug users. In case he is a chronic user, tell him to use a different syringe and not share the syringes. That's how hepatitis B spreads among IVDUs. Okay, treatment interventions is because we have to have a high rate of diagnosis of hepatitis B and hepatitis C. Hepatitis C is by elimination. Hepatitis B is by HBsAg and other rapid tests. Please remember, it is most important to diagnose B and C because they can be life-taking. Hepatitis A and E, even if you don't have a specific investigation to say that it is hepatitis A and E, you are not so much at risk, and you can tell the patient, wait and watch, you'll be okay. We have to also treat hepatitis B and hepatitis C. I talked about certain drugs in hepatitis B. I talked about interferon initially, and then the DAAs in hepatitis C. Thank you for your patience, and next class we will go to the other thing in intestinal diseases. So I hope you've learned a little bit, or have you slept off, or have you just put it on and gone off and done some other work? Class?
Yes, sir.
Thanks a lot.
This conference is no longer